Okay, welcome everybody here at UEG Journal, UEG Virtual Week Live. I'd like to introduce myself. My name is Joost Drent. I'm the editor of the UEG Journal, the flagship journal of the UEG, and I'm proudly are able to present this session for you, but also with you. And with me, I have two important people, one editor of the journal and one very well-renowned author. So, Fernando, please introduce yourself.
Good morning, everyone. I'm Fernando Magro. I'm Associate Editor of UEG Journal, responsible for IBD section, and I'm working in Porto University. Great pleasure to be here with Joost and Alessandro.
Okay. So, talking about Alessandro and Muzzi, you're in the hospital right now. So, Tell me a little.
Yeah, thanks. Thanks for the invitation, Joost, and hello, Fernando. I am Alessandro Muzzi, is a professor of gastroenterology at the Catholic University of Rome, and my hospital is the Policlinico Gemelli in Rome. And nice and happy to receive this invitation to discuss with you.
Good, thank you. So yesterday, actually, we discussed about young prospective novice authors, how to get into the journal. And we had very nice examples of one review paper and one original paper. And this session is more about seasoned authors such as you, Alessandro, and you will tell us our experience without any doubt. But this spring, we were actually confronted with a pandemic of COVID-19. And that had implications for us at home, in the hospital, in the environment where we live in. But it had also its effects on the journal, the UEG journal. Not only because we were working remotely, but also because of the type of the papers that were changing, actually. So what we would like to offer you today is we will like to share the experience from the journal, from an editor's perspective, and that's what I will do. Fernando will tell you about the perspective from an editor as well as an author. And we will engage in a conversation with Alessandro, where he will tell about the experiences he had in Rome, but also the experience that led up to the article that he has contributed to the UEG journal. Last but not least, I would like to encourage you who are in attendance to engage in a conversation with us. You can see in your screen that there is a public chat, and you can ask many questions to us. And be assured, rest assured that I will answer, or I will ask my colleagues to answer all of these questions. So please, if you have any question, direct them to us. So COVID-19 and us as a journal, that has really had some effect, I would say. So in order to go back, I will go back to 2019 and also compare 2019 with 2020 as for us as a journal. So I have no disclosures to make with respect to this presentation, apart from the fact, yes, you know, I'm the editor of the UEG journal, and I would say a proud editor of the UEG journal. So last year in 2019, we published 116 full papers. Those included original articles, review papers, guidelines, and editorials. And 2020, year to date, we are probably publishing 111 articles. And you see that the acceptance rate of the articles has gone down. In 2019, we were able to accept 1 in 4 articles, but now in 2020, we are able to accept almost 1 in 6 articles. And I have to commend my team, my editors, but also the trainee editors, that we do it much quicker than last year. I don't know what happened, but the days to first decision is decreased from 15 to 9. The impact factor has increased a bit, not much, 3%, but it's good, on a good track, I can tell you. What is a big difference for the journal is that the number of submissions has increased impressively. You can see that the numbers of submissions for 2017 and 2018 and 2019 were increasing steadily. And then in 2019, we had a little bit over 600 submissions. But for 2020, we will probably get over the 8, maybe 900 submissions. So that's a big increase. And a lot of that increase has, of course, to do with COVID-19. COVID-19 came to us in the late winter, early spring. And the journal was first hit with a submission on March 22 in this year. So far, and I've counted until October 7th, we have gotten 91 papers with a focus completely on COVID-19. We have accepted 13% of these papers, and they're currently in press or have been already published. And the number of countries submitting these articles, as you can see, and it's quite reasonable for a European journal, are coming from Italy. Actually, 22 of these publications. And Alessandro, it's not without a reason that we have asked you to join us in the conversation, because Italy has been hit particularly hard with the pandemic. It's followed by China, with 12 publications, Germany, United Kingdom, and Spain. So COVID actually has a lot effect on the publication and the number of publications in the medical literature as a whole. I've calculated that the total papers in PubMed for this year is a little over 1 million. But you can see that there are already 61,000 papers on COVID-19 in press or have been published, and that's almost 5%. So 5% of the current publications are on COVID-19. So it's reasonable and very good, I think, that we are going to discuss about COVID-19. Well, what type of papers did we actually get? Well, most of the papers dealt with the effects of the pandemic on our social behavior and organizational structures in the hospital, on how we were doing on the endoscopy, or what did we do with our normal care. So we received systematic reviews, small and larger cohort studies, single but also multi-center, a few case reports with unusual GI manifestation, but in particular we received a lot of manuscripts with respect to organization of care. We have received one guideline, and we've published a guideline from the Chinese organization on endoscopy, how to organize your endoscopy wards in case of a pandemic, which becomes very topical in this autumn. We have received tips from the battlefront, also papers dealing with the psychological effects on us as medical doctors, and also the profound effect that the pandemic has had on clinical training. So, having said this, I like to revert back to Fernando, because we've asked you in this special era to take care of the articles on COVID-19. So tell me, how did COVID-19 affect you as a person?
It was terrible at the beginning due to lockdown, and the hospital activities were completely changed. We improved the telemedicine, and we need to change all IBD activities, our clinical trials, and the way of we are taking care of our patients. And it was also terrible in terms of social activity, because we stay at home, we do not meet with our friends. So it was terrible indeed at the beginning.
So a profound effect. Hey, Alessandro, you were hit a little bit earlier. So what about in Rome?
Well, in Rome, was not like in Northern Italy, and we were lucky by this point of view. We were listening and hearing the disaster was happening in Lombardy, in Piedmont, and in other northern region. And we were constantly in touch with colleagues that were working in that area. And we just were prepared to absorb the wave that indeed was not so big like it was in northern Italy. But this does not mean that we were not scared, we were not worried, and we were not prepared to receive all what has received the area with a lot of patients infected. And Rome is a big city. 4 million of people are living in Rome, and during our lockdown in Italy, the lockdown was in March, April, up to mid-May, more or less. A lot of hospitals were set in Rome dedicated to COVID patients. My hospital, that is a big hospital, had an entire building dedicated to the COVID, to take care of COVID positive people. And during the pandemic, that area was full of people who were admitted. So not in the proportion of Northern Italy, but still with the worry to face something that really nobody knew how to face at the beginning. And I remember that
there was a profound effect. So let's refer back to Fernando. And you were telling us a little bit about telemedicine. So how did you actually establish contact with IBD patients who you already knew, or you had new patients coming in? Just tell us a little bit. How did you establish contact?
At the beginning of pandemic, we changed everything. So only telemedicine and phone with the patients, and we encouraged that stay at home, and we communicated with patients only by phone. And we changed a little bit our outpatient unit, but we keep all infusions in our hospital. Now, and after May, I'm seeing all patients physically, not the telemedicine. The pandemic in Portugal is better. And I think nowadays, all our activity return to near normal life.
Okay. Yeah, in the Netherlands, we are about to see a second wave, and our Prime Minister will talk tonight about possible consequences of the upcoming second wave. We've done telemedicine for all of our patients, and now we do already see new patients live, but the majority of contacts are through telephone. So let's switch gears a little bit, because this subject deals with the UEG journal and the effect of us as editors, as contributors to medical science. So actually, Fernando, when did you see the first publications on COVID-19, and what did it mean to you?
In the UEG journal, are you talking about? Yes. We in the UEG journal, we organize all papers and all submissions in COVID. Just and myself, we were the editors of all COVID. And at very beginning, we are impressed by the number of papers. in March and in April, most of the submissions were case reports and small cohort studies, but the quality of papers improved a lot over time. And now we are receiving good cohorts, good reviews, and systematic reviews. And now we have in our hands a good systematic review with meta-analysis with COVID. So the scientific quality of COVID in UEG journal improved a lot.
Okay. So I suggest that you prepare your presentation, and I see one question coming in, stating that the Italians have really impressed top behavior in their corona protection. I was impressed in Milano. Hope you stay better in the future with the virus than in Bergamo, which is close to Milano. So kudos to you, Alessandro, and your fellow Italians. You did a great job.
Yeah, well, yes, at the beginning was quite a big wave, and some area of the northern Italy probably were not well prepared to face this situation. And could explain the situation in Bergamo, for instance. But I think that today that we are running a second wave, and I would say that probably here in Rome, in my region, there are the highest number of admitted people with COVID positive infection. I think so far that we are quite ready to face and use to have all the precaution that we need to have to manage patients and to be protected. I hope.
Okay. So, Fernando, do we have your presentation? If you can take up.
I'm just preparing, but
take it over. You see.
I will do it. No problem. I will do it. Just.
Okay, Julia.
Good.
Please.
So, indeed, I mean, if I look back, Alessandro, at in the beginning of March, we actually were moving into lockdown. I got a phone call from one of the orders that contributed to the journal. He said, well, we see a lot of patients and we like to contribute this to our experience to the UEG journal. So that's when I really realized, oh, it's going to hit us as well. It's going to have profound effects on us. So that was quite an impressive element, I would say.
Okay, just may I?
Sure, go ahead, fire away.
Thanks. To move the slides?
Click on the plus and take the present role, then you can navigate.
Click in the
plus. Left.
Because it's not in the my screen. Plus. Okay. I'm ready now. So my disclosures, and at very beginning, we publish our paper, and our first paper about COVID-19. It was published in April, and we start with advices for patients on immunomodulators and biologics, and with the general measures as avoid contact with infected people, avoid touching your eyes, nose, and clean house. And advice is also for the travelers, because in March and in April, everything indeed changed. And the IBD patient shall be discouraged to travel, defer all cruise ships, avoid crowded places, and long flights. So are important advice, general advice for IBD, for immunosuppressed people, but also for the general populations. And this was published at the very beginning of April. So I think it was a fast reaction of UEG journal to the pandemic. And also advices for medications and procedures. And we advise the patients to keep on immunomodulators, on biologics, reduce the corticosteroids, particularly below 20, use masks, particularly in IV infusions or in hospital, postpone elective endoscopy procedures, and postpone the start of immunomodulators and biologics. But of course, if the patient is in a flare, you need to treat these patients and initiate biologics. And advice is also for close contact with someone. We advise to follow the national recommendations. And the patients in clinical trials, we try to postpone the follow-up visit with the sponsor. The phone calls were very important at this time, and also patients report outcomes. And one important measure was home drug delivery and improve email reports and also local labs. So we summarize the important measures in this figure in UEG journal, and it was a mission of doctors, of nurses, and patients. And for doctors and nurses, transfer patients to separate unit within hospital facilities to prevent disease spread, particularly for HIV. It was very important. And to implement phone calls, patients report outcomes, monitor at distance, and call protecting and whole point of care were important, and improve hospital, the home drug delivery, promote local lives, and suggest to all patients teleworking. It was very, very important. And also protection levels in endoscopy units. And we publish these in our journal. And if endoscopy was not urgent, postpone the endoscopic procedures. If it is urgent, it is very important to screening the family for fever, fatigue, or respiratory symptoms. If there is travel for outbreak areas, if yes, the endoscopy unit protection, we suggest in beginning of April a level of protection. Patients without a positive screening, screening the patients in terms of fever, respiratory symptoms, myalgia, fatigue. If was positive, again, the protection level of 3. If it was negative, I think the minimal at endoscopic units was the protection level 2. And it was a mistake in some countries to facilitate and decrease this level of protections. In UEG journal, we have a lot of papers about endoscopy and endoscopy strategy from China and from European countries, particularly from Italy. But Alessandro could speak more about. And the ECHO COVID task force publish some roles, and we certify the patients without symptoms suggestive of COVID-19 and suggest the same 2 months later after our first publication. That is, keep patients on immunomodulators, biologics, JAK inhibitors, or reduce corticosteroids, and do not reduce the dose of immunomodulators or biologics. It was very important, and patients who were SARS-CoV-2 positives do postpone biologics, reduce corticosteroids. We could speak more about corticosteroids and the role now of corticosteroids in SARS-CoV-2 positive patients. Do stop immunomodulators and JAK inhibitors. It was very important, but only in affected people. And also a strategy in endoscopy to postpone most of endoscopic procedures and restart after a lockdown in 3 months for patients with dysplasia, patients with mild, moderate flares to confirm the findings of biomarkers, and postpone procedures within 3 to 6 months in those with pouchitis, with flares, but without increase of biomarkers and so on. I'd like you to emphasize this registry is EOIBD registry, and it was the last numbers. Most of the patients in the secure IBD registry are Crohn's disease more than ulcerative colitis, but a lot of the patients now. And the UIBD had also a strategy. It was very similar to UEG strategy and to ECHO strategy. Keep biologics, immunomodulators, decrease the dose of corticosteroids. And here we could see the first publication of UIBD group, and it was published also in April in Gastro. But the first analysis of the secure IBD was published in April in Gastro with 500 to 5 cases, more of the cases with Crohn's disease, and roughly half of the population in remission, but there are some patients with mild, moderate, or severe flares, and a high proportion of patients in monotherapy with anti-TNF. And I'd like to emphasize of this paper is the risk factors for intensive care units or death and hospitalization. And the corticosteroids is a red flag, of course. Anti-TNF in monotherapy was not a red flag. Odds ratio was 0.9 and the range was between 0.3 until 2.1. But surprisingly, very surprising, 5-ASA was also a red flag, and with a odds ratio of 3.1. And this analysis was adjusted for age, for disease, for flares, and for comorbidities. And in the last publication of the SCURE IBD, and the last numbers, as I know, 5-ASA and corticosteroids are and persist as the red flags in IBD, but this analysis doesn't have adjustment. So I wrote to Gastro, and I have an explanation for this, because 5-ASA binds to PPR gamma, and the PPR gamma increase the expression of the receptor of the SARS-CoV-2 virus. And with the increasing of the receptor, we could have an increased risk for IBD patients. And it is very important to emphasize that this increase of PPR gamma expression and the receptor of SARS-CoV-2 was induced in the maintenance dose of 5-ASA. So it is an impossible explanation for the risk for 5-ASA in IBD, and for a trend of increased risk of complications in ulcerative colitis. UEG, as I said previously, has a publication, a meta-analysis about this, and 5-ASA and corticosteroids and ulcerative colitis, all of them are risk factors for complications in IBD patients infected by SARS-CoV-2. And all you have here, Just and Alessandro, my message, and I'm ready for questions.
Okay, thank you so much for bringing this to us. It's a really nice and complete overview backed up by the echo. So it's really nice. I see that people can also raise their hand if they want to say something. Then you can engage in the conversation. Perhaps Franco will ask us anything. But let's revert back to you, Fernando. Your paper, actually, which you published early in April in the UEG journal on the effect of COVID-19 in gastroenterology, really picked up attention, I have to say. I mean, it was seen on social media, and also your colleagues have begun to cite the paper. You have any explanation for that or any reasoning?
Because in April and in March and in May, we are very scared about the virus, and you need to learn everything about lives, how to deal with the patients, how to deal with the people. And I think our paper has and has important information with the virus, and most of the information still actual nowadays about the virus.
Okay, so let's move now to Italy. Alessandro, you are a very prolific author on this topic, COVID-19 and medicine. You've published, I saw, at least 8 papers on this topic. So could you tell us what is the common denominator of your papers? Are they advices? Are they is it original research? Just tell me.
Oh, well, thank you for the question. I'm not alone, but I have a good team, I would say. And one of the team is I see that is is a guest in the audience. And the common denominator was that we were working a lot in that period, but we are also a lot of people. And so we separated some duty. And at the beginning, I would have liked to report for people who were not aware about the pandemic, maybe some European country, maybe the US, what was going on in Italy. That was the first European country to be involved. And specifically, the paper on UEG journal was tried, myself, Franco Ferri, and Daniela, Sara, and Giuseppe, and other people that are the main authors, was trying to give a snapshot on what was going on in a big IBD clinic with respect to the pandemic. And we tried to report number, so reality, and not only opinion, and just to let people eventually know how could be organized in the future to face a very stressful period for us, but also for the patient. And I see that in the paper, I mean, it's just a paper on organization, so it's partially scientific, but there are numbers that could have led colleagues to understand how to best organize in a period of crisis like it was 6 months ago.
I think you're right, because I think that the change of the organization is really important, because many European centers grappled with the question, what should we do and how should we do it? I'll give you an example. When it actually hit us, home actually, my colleague has been to a conference in Southeast Asia in February. And then there was a colleague from Wuhan who would come, but then did a remote presentation. And he was telling us what the profound effects of the pandemic was at that time in Wuhan, how they were really dealing with the infection, what the effects were on the endoscopy. And also, and that was something that really struck us, that there was also mortality of colleagues actually on the battlefront. So that is we realized at that point of time, we need to change our care. And your paper actually really helped us in order to change our care in a good direction.
Yeah, I hope that this was the main aim, that could have been of utility on that.
Yeah. Fernando, we took the challenge on to really divert the high number of papers in a good direction. Tell us a little bit more about that.
Yes, in UEG journal in March we received a lot of papers, but most of them are case reports or small cohorts with small number of patients with COVID, particularly in IBD or in liver diseases, or some strategies not yet validated in endoscopy units, particularly from China, and some advices and concerns about corticosteroids, immunomodulators, so some important strategy for March and for April. But now we have good papers with good cohorts, and one meta-analysis that I think it will be very important to realize better what SARS-CoV-2 acts and promotes the disease and the risk factors for intensive care units, hospitalizations, and new strategies in this setting.
Okay, thank you. That's a really good point you make about also the dollar papers. has increased because we have some instances. I remind you the papers that have been published in Lancet that needed to be retracted afterwards. How do you actually check the methodology of the papers that are being submitted? Because most papers were actually made in a kind of rush, and I will ask Alessandro the same question later.
I think it is an excellent question. Now, we do not accept papers without clear results, without clear findings, and without a clear methodology in terms of statistical analysis. And it is very important because now we know a lot about the virus, and you need to be long and more deeply that at the beginning to have the right message. And I fully agree with just to avoid some mistakes in March has some papers in Lancet.
Yeah. So, Alessandro, you also produced a number of papers. How did you check for the methodology? How to keep the high level that we have become to use to expect from you?
Well, trying to produce something of original first, because I think that the paper on COVID, the pandemic, and specifically in the gastro community, are really a lot. So if there is something of original ideas also, it could be worth to report. Duplicates of same aspect that have been already reported, in my opinion, today that makes sense to report, and also in my activity of reviewer or assistant editor of another journal. Sorry, I look to this because to be original today in the field of COVID and gastroenterology and IBD, with regard to my focus, will deserve some chance of publication. So what the authors would like to demonstrate, what are the results. I agree with Fernando. If there is some statistical issue, this could be important also for acceptance or reception. So I think that we have born 8 months ago with COVID. Now we are enough grown to be more rigorous in accepting or not publication on the topic. Otherwise, will be just only paper and nothing else.
So you say to us as research community, stop repeating what is already out there. I mean, I showed you the data. We have 61,000 papers on COVID-19, of course, COVID on neurology, COVID in ophthalmology, COVID in dermatology. So there's a lot of wealth of data already there. So let me ask you the question now: is if you were to see new papers on COVID-19, and let's stay with your area of interest, IBD, what type of knowledge would you like to see? What type of knowledge is important for you and your patients?
Well, one point is to have a big registry, an update of the bigger registry that Fernando mentioned in his presentation, to better understand what is dangerous or not for our patient. First of all, I am a doctor, and also during the lockdown, so I remember I was scared sometime about giving patient immunosuppressor. Then I understood on the field and also collecting data in Italy and also reading paper on the topic with the result, not with opinion, with the result that some drug could be useful or not dangerous for our patient. This could be the first issue that I would like to see. Second, some kind of possible physiopathologic interaction between the virus and the intestine, because there were a lot of postulation. One postulation came also from my group in another journal, was the frontline cover, the possible interaction with COVID lung and intestine, and the ACE2 receptor are also in the intestine. So some pathophysiological study could help also to understand better the mechanism, and then some probably some reports on well, I think that this could be more from Europe, that is living a sort of second wave. Some result, only result, not how to dispose the setting. Some result on the second wave and how clinician or a center was prepared to face and cope during the second wave with respect to the first wave. Because I think that this could be useful for people like in the US, that they are living still the first wave, in my opinion. These are probably the topics that I would like to expect.
So if I summarize this, less hypothesis, more robust clinical data that steer clinical decision making, and also information with respect to the phenotype of the second wave relatively to the first wave, because there are apparently some differences there. So how is that for you, Fernando? If you are looking forward, what type of information that you would like to see in the medical literature and of course in the journal?
I agree with Alessandro. I think we should take attention in the second wave, and the strategy to live with the second wave. But I think you need good predictors of bad outcomes, and to explore the cohorts from the first wave, to know more strong and robust predictors of worse outcome in COVID-19 patients, and to know the more about the infections or and the infectivity of the virus in the feces. What is the meaning? I think you need to know more, and strategies, fast strategies to look for the positivity of the virus, particularly antigens, fast serologic tests, and to live fast and rapidly with the positive patients without block again the hospitals. So in UEG journal, you need predictors, new strategies to go on with the normal activity, and the new strategies to diagnosis in a gastroenterology perspective the infected people, and to screen the infected people.
I think that's a nice addition, I would say, indeed, prediction rules, and also a little bit more insight into the pathogenesis. So, Alessandro, you are probably in Rome also in the second wave, like we are in Northwestern Europe. How is it affecting you? Any changes already? Which is there a lockdown or lockdown in the making?
Well, I was expecting the second wave, actually, personally, and so it does not change a lot my behavior in the hospital and my behavior out of the hospital. having lived the first wave in a sort of first line, and for some weeks I was directing also a COVID ward. So I think that I'm scared a little bit. I don't want to lie, because still we do not know a lot on the topic. But I'm quite confident that we are ready to face the possible increase of rate of infection, trying to ensure to our patient the best would be possible in this situation, obviously. So we are ready to do home delivery. We are ready to postpone a non-urgent visit. We are ready to warrant urgency and IV therapy like it was 6 months ago. So we are ready, actually.
Good, you're better ready. That's good to hear. So Fernando, second wave in Lisbon. Franco, stop. I'd like to hear Franco.
Hello, hi. Thank you very much for this opportunity, and thank you for this very interesting interaction and discussion about very, very intriguing topics. I was just wondering, listening the perspective of how improve quality of papers in this field, and also how important could be to focus on several other urgent topics for the future articles to come. And still, I think we do need more efforts in organizing our clinical job, not just observe what happened, but also reorganize, restart a new way of being IBD unit during a pandemic that we learned that is not finished yet. And actually, we have to cope in this pandemic for at least 1 or 2 more years. So my question that I would like to ask is, so for several original paper, we need time and also methodology. What about papers on the organization of our everyday? For instance, in our paper, the one that you were discussing also, that we described what happened in our high volume center to our patients and our planned visit and so on. I think that we started to think about more, new way of doing medicine. So telemedicine and another thing. How should be a paper regarding organization to be very strong and very highly accepted by UEG or other journal in the gastro unit when those papers are coming from physicians or clinician like we are. So I would like to invest more a little bit, because I think we learned a lot in terms of organization following the COVID pandemic. And this organizational hint could be important not just for the pandemic itself, but also for IBD clinic of the future.
Good, Franco. You make an important point. You make an important point. I would say, and it's for me, it's easy to ask Fernando to address that question. I mean, in this current age and in the time where we're living in, still some room for papers on organization of IBD care.
Just is an excellent point. I have some doubts about, as an editor, you need strong papers about to be accepted. That is, papers very well structured in terms of numbers, findings, and showing and depicting how the strategy results. And analysis of the findings, because at the beginning we only have ideas without numbers, and now you need a solid structure with solid findings to accept the paper in my perspective. But for instance, Franco, we have not covered areas. For instance, it was published in this week in a very important paper. I think JAMA and in the cell, the importance of systemic calprotectin as a marker of severity in the blood in COVID to infected patients. And do you know enough about calpo in feces in IBD and infected patients? It is an uncovered area, and if you have a good research in this setting, I think it will be easily published. So I think now we are looking for new ideas. Do you understand, Franco? Is my perspective.
I think that's, if I may take the role as an editor, I think, Franco, we are looking for original papers that really are able to help us. And if you want to know my perspective, I think that multi-center papers within a nation or even across borders, where you pack in the data from a lot of patients, is really helpful, because that's what Alessandro told us. Is bringing more robustness to the study. So I think that's valuable. Alessandro, anything to add?
Not really. I know Franco very well.
He worked with you.
I will go downstairs in a few minutes and I will speak with him about new ideas.
That's good.
I think that what we need today on COVID, and with refer to IBD, obviously in my perspective, not only to IBD, but mainly to IBD, is to have, as I told you before, original result and the big result, big number, because we need to understand better what is the impact on our patient and what is the impact on the disease itself. With a rigorous methodology, like Fernando suggested before.
Yeah, I think you're right, because that's what the journal actually needs. I think that we all would like that data coming from the journal actually helps us in clinical practice and is able to guide us through the clinical decision making. That's why we publish these articles in the journal, and we also publish guidelines in the journal. So Fernando, we are almost coming to an end of this conversation that we had. Do you have tips for prospective authors of the of papers that are going to be contributed to the UEG journal? In general, which articles you like and which articles you think should be written?
Predictors of outcome will be very, very important. Virus in the feces and the load of the virus in the feces, and what is the meaning of the loading and the virus in the feces. The rapid tests, what is the role, the meaning of the rapid tests in gastroenterology and endoscopy units you need to look for, and also the importance of calpo systemic and in the feces, in diagnosis and predictor in COVID-19 patients.
Okay. Last question to Alessandro. Alessandro, what's your next hot paper?
Not the next one is not on COVID.
Good.
And because I think that we should keep on to do our research irrespective of COVID or not. It's some with Franco, some pathological work ongoing on patient with COVID, but still has to be elaborated. So it's not hot, it's warm.
That's good. So this brings this UEG learning community to an end. I would say this was the second of a series of two conversation that we had with the readership from our editorial team. I would like to thank Fernando Magro for contributing. Alessandro Armuzzi, thank you so much. Also, Franco Scalvaderi, thank you for the contribution. Thank you for preparing, and please contribute to the journal, because that's why and how we make European gastroenterology better. Thank you so much, and have a great conference here in UEG virtual. Thank you.
Thank you. Thank you.